Okay, well, hopefully you enjoyed that video that explained a little bit of some of the hypotheses that have been offered to try and explain what causes morning sickness, especially during the first trimester. I really wanted to emphasize a couple of the things that they brought up. One of the explanations that's gained a lot of traction is the idea that morning sickness may be a protective mechanism to prevent the kind of pathogens from actually entering the bloodstream that could cross the placenta and harm the developing fetus. So, and that would make a lot of sense. The kinds of things that on average pregnant women don't find nauseating are things that are very unlikely to contain pathogens. And so you oftentimes see, breads or other kinds of, really simple carbohydrates being the things that they're attracted to. And they really will develop taste aversions to things like meat or dairy products, things that are more likely to contain, some kind of bacteria or something that could actually possibly harm the developing fetus. So they've really been looking at that kind of explanation, as well as the idea that hormonal levels might trigger overproduction of saliva or other things that can actually make you feel nauseated. The key thing to remember, though, is that it's really characteristic of the first trimester, but that doesn't mean that it doesn't occur during other times in pregnancy. Some women report that they throw up every single day up to and including the day they give birth. Other women never throw up. So there's a wide variation in how women react to these changes that are going on in their body, and especially with regard to food aversions. Okay, so let's talk about something even more troubling than morning sickness, and that would be miscarriage. So miscarriage during the first trimester is fairly common. There are a lot of things that can trigger a miscarriage. Biologically, the most common explanation for miscarriage turns out to be chromosomal abnormalities, where there are 3 chromosomes where there should only be a pair of chromosomes, or there's just one when there should be 2. Those are the most common kinds of chromosomal abnormalities. Sometimes miscarriage occurs because there are hormonal problems in the mom that can cause, not enough progesterone to actually protect the pregnancy and keep it intact. So the hormonal problems are oftentimes, if it looks like it's a pattern, those would be treated with hormone replacement kinds of treatments. Having vaginal infections can trigger miscarriage. Having bloodborne kinds of infections can also trigger miscarriage, like food poisoning can trigger miscarriage, especially something like E. coli or salmonella. And then other kinds of maternal health problems, like maybe a clotting disorder that causes clots to form and basically choke off the placenta. There are a variety of chronic health conditions that are associated with miscarriage and things like that. And usually if a person has those chronic conditions, then they're aware of it and they can do things about it to mitigate the likelihood. But sometimes it's just something that happens randomly, through just like this chromosomal abnormality or a one-time hormonal problem or something like that. Age is one of the best predictors of miscarriage. Women who are less than 35 years old have about a 15% chance of miscarriage, whereas between 35 and 45, that chance goes to 20 to 35%, and then women who are over 45, they have a 50% chance of miscarriage. And this is something that, our media kind of implies, well, if you're generally healthy and, we see people like Michael Jackson's sister, I can't remember which one, but had a baby at like 54 or something. And you see John Travolta's wife, Kelly Preston, who had a baby at 44. And you see these celebrities and you think that fertility, if you're a healthy person, fertility will stay. And it actually turns out that with age, fertility declines. And one of the biggest ways that women find that out is that they've got this bigger chance of actually miscarrying. So even if she's still having menstrual cycles and so she thinks she's ovulating and that her hormonal patterns are typical, she may discover that, in fact, her fertility is impaired through a series of miscarriages. So the older a woman is, the more likely she is to have a miscarriage. And then there are lifestyle factors. I pulled this picture off the internet. I pulled them all off the internet, and I'm just really hoping this is a model drinking her beer and smoking her cigarette while she's noticeably pregnant. But I think they're just trying to convey the issue that these are things that have been associated with miscarriage. Smoking, one of the reasons why it's associated with miscarriage is that smoking constricts blood vessels. Anybody who has smoked or does smoke can support the claim that, your hands will get cold and your feet will get cold when you're smoking. And that's because of constriction of the blood vessels to the extremities. When you have constriction of blood vessels to the placenta, then you're going to have the fetus deprived of nutrition and oxygen and unable to pass their waste off to mom's blood to be cleared. And so that's the way that smoking is thought to actually be associated with miscarriage. Different kinds of drugs have different kinds of miscarriage risks. Some drugs are very closely associated with miscarriage, like, for example, stimulants, so cocaine and along those lines, or amphetamines along those lines, whereas other drugs have not been associated with miscarriage. For example, the opioids have not been associated with miscarriage. There's a very large study going on right now at the University of Washington where they're trying to determine whether there's a link between marijuana use and miscarriage. A lot of moms have been using marijuana in the first trimester of pregnancy as a way to help with their nausea and morning sickness. And so the study is looking at women who are just, doing that because they were going to do it anyway, and see if they actually have a higher miscarriage risk than women who don't use marijuana during the first trimester. So that study is still undergoing, and we don't know the outcome yet on that one. Malnutrition, it's not just being, starving. That's not the only definition of malnutrition. Malnutrition means that you're not getting adequate nutrition, not just calories. So a person might be getting adequate calories, but they aren't getting the appropriate vitamins and minerals and other things that they need to support the developing fetus. And so that increases the likelihood of miscarriage. We see this among teenage moms who may be in denial about their pregnancy, and so they go about the same diet that they might have been eating because they're a teenager. And so a lot of empty calories, caffeine present in the drinks that they're consuming, lots of fat relative to fiber, and not very many vitamins and minerals. And so those things, the lack of those things can trigger miscarriage. Excessive caffeine. Now, just to clarify, a typical cup of coffee, drip made in a coffee maker at home, not something from Starbucks or something, but like drip coffee, tends to have about 125 milligrams in 5 ounces. So I wanted to make sure that you knew that kind of proportion when I tell you that excessive caffeine means more than 500 milligrams per day. So that's a lot of caffeine. And then exposure to different kinds of teratogens. Teratogens are chemicals or other kinds of experiences that can have a negative effect on the developing fetus. So actually, a lot of the teratogens have their biggest effect on the developing embryo. So teratogens could be poisons, they could be like viruses or bacteria, or they could be things like radiation. So there's lots of different kinds of teratogens in the world. During the first 2 weeks after conception, remember that the blastocyst is making its way down the fallopian tube and doesn't implant until day 14. So there's no known teratogen that could affect the blastocyst during that phase. Like once conception has occurred and up till implantation, there's no known teratogens during that time. When we get to weeks 3 through 8, which is the part of the embryonic phase that is from implantation until we exit this phase, there are a lot of things going on. If you remember the pictures that I showed you, there are a lot of very big, what we call morphological changes that are going to happen in the embryo. They're developing their arms and legs and their fingers and their toes and their hearts and their livers and their brains and their eyes and things like that. And when I say brains in this context, remember, we're talking about the very low level parts of the brain, right? So the things that you need just to have a heartbeat or just to be able to breathe, things like that. So during the period between 3 and 8 weeks, once the blastocyst has implanted and become an embryo, there are what we call critical periods, where things are changing on the embryo, and the presence of a teratogen could actively interfere with the development of whatever is going on. So on the first row, you see neural tube defects. That row is referring to the development of what we call central nervous system, the brain and the spinal cord. So in the absence of adequate vitamin B, or what's called folic acid, the spinal cord, which, as we saw in those pictures I showed you, is one of the first things to really develop, will not be fully surrounded by spinal column. The developing vertebrae there will be gaps present in the absence of adequate folic acid. So you can get these kinds of what we call neural tube defects. You might know somebody who has spina bifida, and that's a defect that occurs during this very early stage of embryonic period, where the spinal column has not fused around and encased the spinal cord. And so that can lead to paralysis in the lower limbs, is the most common outcome of that. There are a variety of other symptoms of that. But that actually happens in the absence of proper nutrition. It's not happening because of exposure to something. One more row down, we're talking about the development of the heart. And remember, in the pictures that I showed you, like very early, the heart is there. It's outside the body initially, but it's there. So if some kind of teratogenic substance was present, it could interfere with that developing heart, and you could end up with some kind of damage to the ventricles or to the atrial components of the heart, things like that. One more row. So anything that's lavender, that's the time when the developing embryo is really sensitive, really likely to have a bad outcome if they're exposed to something. We see the next two rows being the upper limb and the lower limb. And to give you a cautionary tale from the old days, back in the 1960s, there was a medication called thalidomide that was developed for specifically women to take during the first trimester of pregnancy to deal with morning sickness. And it was not very commonly prescribed in the U.S. because it hadn't gotten through FDA approval, but it had been used in Europe and in other countries. And we were kind of glad that we dragged our feet on this, because around the world, babies were born missing their arms and or missing their legs. Some of these babies had no arms, but they had hands coming out of their shoulders. And that really shows you that the mom took the thalidomide during the critical period for the development of the actual arm, and then stopped taking it during the time when the hand should have been developing on the end of the arm. But given no arm, the hand developed out of the shoulder. And some babies had feet coming out of their hips for the same exact reason. And then some babies were just missing their limbs entirely, just had head and torso and were just completely missing their limbs. And like I said, this was much more likely to happen in other parts of the world because the FDA had not approved it here in the U.S. But we did have women who were visiting other countries or were living in other countries and were prescribed this medication. They took it and then they came back home to the U.S. with a baby who had these defects. And so they very quickly tracked it back to the thalidomide, and it was pretty much banned everywhere as a result of that. It came back on the market, and you might have even heard of it if you know anybody who's ever suffered with AIDS, because one of the biggest problems in the later stages of AIDS is that the person starts to waste away because they just really can't eat. And so thalidomide can really help them with their nausea so that then they can eat. And it was quite controversial when it was introduced as a possible treatment for the lack of appetite in an AIDS patient, because they were saying, if a woman takes this and doesn't even know she's pregnant yet, we're going to have these birth defects. And it's like, well, I think we can put adequate black label warnings to make sure that people don't share their medicine with somebody else. So it's been used for very rare purposes now, but otherwise taken off the market because of these teratogenic effects on developing babies. So there are different kinds of things that we know have different kinds of effects on the developing fetus's body. And really it's a matter of when these things are taken. So for example, if a person started to take thalidomide after the embryonic period, which I don't know why they would do it, it would be much less likely to have the impact because we have moved out of that really highly sensitive period. And in fact, when we get off into the fetal period, you'll notice there are very few places where there is a purple or lavender bar indicating, a really highly sensitive period. One area where you'll notice that the purple bar extends all the way up to the 30, I think that's pointing at 30, 28 weeks is where that purple bar extends up on that first row. That's a very critical period of time for the development of the cerebral cortex, the part of the brain that actually is used for all the stuff that we do as humans, right? All the critical thinking and all the, really high level reasoning that we do and things like that. And so if mom is exposed to radiation, that can cause slowing of the development of those neurons that are developing during that period of time. And so when the baby's born, you'll see evidence of that in lower IQ, learning disabilities, other kinds of things. If mom drinks really heavily during the period of time when this is, we've got all this brain development going on, we end up with these kinds of reduced IQ, reduced reasoning, stuff like that. You'll notice it's all the way up until about the 30th week of gestation that we are worried about the developing brain. There are certain things. There's radiation. There's alcohol that have been closely tied to, the developing brain. Certain infections have also been tied to it. If you've ever wondered why we vaccinate for measles and things like that, part of it is because we don't want you to have the measles, but also if a woman is pregnant and then catches the measles while she's pregnant, it can impact the developing ears of their baby. And you can end up with a baby who's deaf as a result of having had a mom who had what's called rubeola, right? That type of measles. So if you know anybody who has stains on their permanent teeth, that may be because mom was prescribed certain kinds of antibiotics during the 7th or 8th week of pregnancy, and that leaves staining of the teeth. So there's just all these things that can happen, and those are called teratogens. Okay, I didn't hit them all. There are lots of teratogens in the world, unfortunately. The good news is that the placenta protects the developing fetus from a lot of teratogens, but some can cross the placenta, and those are the ones that are going to have the effect on the developing fetus or embryo. Okay. That seems like enough for right now. So I will meet you back here for our discussion of how we can do embryonic and fetal testing to look for abnormalities.